Hi, we are the Sacred Heart University speech pathology grad students. We heard you guys have a lot of kids with a stutter and we wanted to teach you guys more about it. My name is Kate.
I'm Allison.
I'm Haley.
I'm Meredith.
So just a little bit of an overview on stuttering. Stuttering is the most common fluency disorder, and it is an interruption in the airflow of speaking characterized by specific types of disfluencies. These might include repetitions, where a child might say, look at the baby. So they have that repetition of a sound or a word. Prolongations, where they might prolongate a sound like sometimes. Or they might also have a block, which is an inaudible or silent fixation or inability to initiate a sound.
So just touching upon the prevalence, so 1% of the world's population stutters, which is over 3 million people. 88 to 91% of these students recover spontaneously with or without intervention. And although this seems like a small percentage of the world is affected by stuttering, and most children outgrow their stutter.
Some factors to consider for stuttering. Family history of stuttering increases the likelihood for a child to stutter, as well as gender. Stuttering is more common in males than females. Also, males are likely to persist beyond the age of 4. So this means that typically in males, they'll continue past 4 compared to females. Also, the age of onset, children who stutter at or beyond the age of 3.5 are more likely to persist in their stutter, and the time since onset. So stuttering that lasts longer than 6 to 12 months has a decreased likelihood to outgrow the stutter.
So stuttering versus cluttering. So stuttering and cluttering are both fluency disorders and they can co-occur, but they are separate disorders. So stuttering is a fluency disorder that is characterized by those repetitions, prolongations, and blocks, and it affects the overall communication. Cluttering is a fluency disorder that's characterized by rapid and or irregular speech rate. It's very unclear and disorganized sounding speech, and it can be seen alone or with stuttering. And this affects more of the pragmatic communication. So that's the social communication side of things.
And we just wanted to point this out because oftentimes cluttering could be mistaken for stuttering.
So next we have some intervention goals that might be targeted in therapy for children who stutter. First and foremost, we really want to increase the child's self-confidence and self-efficacy. We want to make sure that children who are aware of their stutter are confident in speaking and that they're able to talk with peers about stuttering. They're able to, communicate in a typical way. We want to make sure that they're still able to talk in social settings and they're not feeling isolated. We really want to decrease anxiety while communicating, increase overall social communication participation within the classroom, outside the classroom, on the playground, in any situations. We want to decrease secondary behaviors. So these can be things that the child might do while they're stuttering. And we just want to make sure that those are decreased so that they don't persist. And we want to encourage family support and involvement. And that comes from us encouraging family to talk about stuttering in the home, provide them with some tips for while they're at home, and as well as getting teachers involved in the classroom as well.
So we put together a list of some tips for teachers. First, set a comfortable pace. So you should be aware of your speaking rate and use pauses throughout speaking to reduce time pressure students may experience. Also, you should decrease interruptions within the classroom and encourage students to take turns while talking to one another. You also want to be practicing the turn taking with the students so they get that good modeling. Also, you should allow increased response time. And lastly, reflect what the student says so that they know you are fully listening by engaging in their conversation, asking follow-up questions, making eye contact, all of those good listening skills. Second, you want to make sure you're exhibiting positive attitudes about differences within the classroom as a whole. This is important to make everyone feel included and not excluded. Thirdly, you want to observe communication and interactions amongst the students. This is important for something like bullying. So you want to make sure that if you do have a student in your classroom that does stutter, that they aren't being bullied in the classroom. And if they are, you want to make sure you're addressing that. And lastly, you should speak with the individual that stutters to create a plan that fits both you and that student. Some students like to talk about the stutter, it helps them. Some students may tell you, no, I don't want to talk about it. So really just having that one-on-one meeting with them to establish things that could help them and can help you.
So we wanted to talk about some do's and don'ts when you have a student who stutters. So allow the student to finish their complete thought or sentence. So don't finish a student's thought or sentence. Be patient. Don't rush the student to finish speaking, and encourage communication. Don't give simplistic advice. And this simplistic advice would be telling them to slow down or take a deep breath. You really just want to allow the student to get the full thought out without an interruption.
And in the classroom, these are some things that we can do. Allow increased response time, so just allow them to get what they want to say out without saying anything. Monitor group interactions, possibly pair children who stutter with easygoing partners that allow equal contributions to peer work. Minimize rapid response or call out approaches. So if you want to call in a student to popcorn read, maybe let them know ahead of time if they have a stutter. And speak openly about stuttering, make it something that's not abnormal or different, just something that happens to some of our students.
And if you have any additional questions or need additional advice, please reach out to us.